I am Dr. Rajcumar. I am a psychiatrist. I live in Fredericton, and I've been working for the past 4 years at the Woodstock Mental Health Center with a child and youth team and the VAC team. Bipolar disorder manifests a bit different compared to adults. Children have more rapid mood shifts even within a single day. They have irritability and aggression, which is more common than the classic euphoria in mania. Children also have temper tantrums or rage episodes, and often it is misdiagnosed as behavioral disorders. They also have sleep disturbances, very little sleep in mania, and excessive sleep in depression. Children also have difficulty with concentration and impulsivity, sometimes resembling ADHD. Also, children have more of mixed episodes. A mixed episode is they have both mania and depression at the same time. Bipolar disorder can develop at any age, but most commonly it emerges in late adolescence or early adulthood, typically between the age of 15 and 25. However, it can also appear in childhood. In this case, it is known as pediatric bipolar disorder, though it is less common and quite challenging to diagnose. Some children may also show early symptoms as young as 6 to 10 years. Parents should be aware of extreme mood changes that go beyond typical childhood emotional ups and downs. And these symptoms interferes with daily life and they are out of character or personality. Some key warning signs include, so in terms of manic symptoms, there is unusual mood swings, meaning there is periods of extreme happiness, irritability or silliness that seems excessive. There is decreased need for sleep, so they go for long hours with little or no sleep, but still they are energetic. They are also impulsive and they take part in risky behaviors. So for example, they take dangerous risks such as jumping from high places or engage in reckless activities. They also present with grandiosity, meaning unrealistic beliefs about their abilities. For example, they might think they have special powers. There is also presence of racing thoughts and rapid speech, so they talk excessively, quickly, and changing topics quite abruptly. In terms of depression symptoms, key warning signs also include persistent sadness or withdrawal, losing interest in their favorite activities, fatigue. There are changes in appetite and sleep patterns. Either they are eating or sleeping too much or too little. There's also thoughts of self-harm or suicide. Diagnosing bipolar disorder in children is quite complex and it requires comprehensive evaluation by mental health professionals. Since mood swings and emotional outbursts can be part of normal childhood development or resemble other disorders such as ADHD, anxiety, or depression, a careful assessment is crucial. So number one, we'll do a clinical interview and history taking. Here, a psychiatrist, a psychologist, or a pediatrician with expertise in mood disorder will conduct detailed interviews with a child, their parents, and caregivers to understand the symptoms. We'll also gather a family history of mental health conditions, as bipolar disorder has a genetic component. We'll also ask about sleep patterns, energy levels, mood changes, and behavior at home and at school. To diagnose bipolar disorder, the clinician should check whether the child meets the criteria outlined in DSM-5. And this includes episodes of mania or hypomania, episodes of depression. Parents, teachers, and caregivers may be asked to complete a standardized questionnaire to assess mood and behavior, such as we have a childhood depression scale, we have a young mania rating scale, and mood disorder questionnaire for adolescents. We also do neuropsychological testing. This testing will help to differentiate bipolar disorder from other conditions like ADHD, autism spectrum disorder, or learning disabilities. and this psychological and neurological testing may help assess cognitive functioning as well. We can also do some medical and lab tests, blood tests or physical exams to rule out medical conditions such as thyroid disorders, which might cause mood symptoms. Sometimes sleep studies are needed if the sleep disturbances are severe. One must also understand that bipolar disorder symptoms can fluctuate, so doctors often monitor the child over weeks or months before making a diagnosis. So the exact cause of bipolar disorder in children is not fully understood, but it is believed to result from a combination of genetic, biological, and environmental factors. A child with a parent or sibling who has bipolar disorder is at a higher risk of developing it. However, having a family history does not guarantee that a child will develop the disorder. Concerning environmental triggers, severe stress, trauma, or abuse can increase the risk of developing bipolar disorder in children predisposed to it. Also, major life changes such as parental divorce, moving, losing a loved one can act as a trigger. Other mental health conditions such as ADHD or anxiety disorder, substance use or exposure to drugs at an early age. So, treating bipolar disorder in children involves a comprehensive approach that combines medication, therapy, and lifestyle management. The goal is to stabilize the mood swings, help the child develop coping skills, and minimize the disruptions to their daily life. The choice of medication depends on the child's symptoms and specific needs. Common medications include mood stabilizers. So here we have lithium, which is a commonly prescribed mood stabilizer that helps controls with manic and depressive symptoms. We also have valproic acid. This is another mood stabilizer that may be used when lithium is not effective or suitable. We also use antipsychotic medications. These antipsychotics, they have mood stabilizing properties. They include risperidone, aripiprazole, that can be used to manage manic symptoms, including severe agitation, irritability, and aggression. We also have therapy. Therapy plays an essential role in managing bipolar disorder, helping children and their families develop strategies to cope with the challenges the condition presents. In terms of therapy, we have CBT. CBT can help children identify negative thinking patterns and develop more positive, realistic ways of thinking. It also teaches coping strategies to manage mood swings and stresses. So, resources and support for parents, family, and caregivers, they can call the Child and Youth team during workday hours or mobile crisis unit, which work quite late in the evening. So the Child and Youth team, it is a multidisciplinary team made of caring professionals with training in counseling, social work, occupational therapy, psychology, education, nursing, mental health, and addiction. The ISD team is available in schools, mental health sites, and other community settings.